We'll start this session as a very interactive session on medical tourism as well as on providing affordable healthcare and treatment. So as a preamble, I think we have decided, since we have only three speakers, three people, and two of us are making a presentation, and then the third one is going to speak, and then all of us will sit down and have interaction and take questions. So I think we were given originally 70 minutes, but since the time has passed, so we'll try to finish it within 1 hour time. And feel free to note down all the questions and send it to across. That will be very easier way. Or you can talk at the end of the session. I think medical tourism, whether it is an overkill, let's look into the reality check. The challenges which are there today facing globally is whether medical surgical treatment in Asia or India is anyway cheaper or better quality or not. Because the concept came for attracting people from the West to the East world for providing a cheaper and also more relaxed environment, like people have been coming to India to visit Goa or Rajasthan, and if they have a problem, they would like to get treated. It started with that several years ago, not anymore. I think with the advent of my next speaker, who is going to talk about the software which is involved and some of the other work which we are doing, getting the appointments, the telemedicine, the faculty, the post-op, and the ethical issues are becoming very, very significant. Just take an example of one of the hospital where I'm associated as a trustee, a Jupiter hospital based in the north of Mumbai in Thane. They built the hospital along with a fortune hotel with the thinking that the patient's relatives can come with a comfortable environment, and they don't have the rates like probably the Taj hotel rates, but very good facilities. But whether the cost is really matching to the aspiration of the people or not, that we are going to discuss in this. The hospital we talked about has 11 OTs, including the cadaver transplant for renal and many of the other indications, liver, lung, and probably the heart transplant in the future. But reality check, we are going to do it today. So let's talk about some of the solutions which we can provide to the healthcare industry to provide affordable healthcare. As I said in the morning while receiving the award, that our aim is to provide smile to billion faces. And today on Valentine's Day, I think that's the best gift we can give to the society at large. The Saint Valentine, the church which I visited in Montreal many years ago, and I understood how a humble person could change with love the whole world. The first disruption which we can talk about providing solutions to the med tourism is via globally patented portal called Virtual Specialty Hospital, which was founded by Joseph Weizenbaum, the father of AI from MIT and robotics, along with some of the people in our organization and our association, with the name of Hospital Software, providing artificial intelligence-based knowledge acquisition tool. The med tourism leads to telemedicine, taking care of the trauma centers, which have been mapped, the clinical research organizations, the transportations of the patients, their management, and post-op. That is one of the very critical things are catered in this particular portal. We also come beyond providing just the operatives. People were talking about medical tourism, like somebody needs to get an operation, it costs in London X pounds, or in US X, Y dollars. So come to India, you will be like half the price or 1/3 the price. Not anymore. People are talking about quality treatment with cost or not necessary cost, because quality doctors are there. The if you look into, many of my colleagues are managing the major hospitals in United States and London and in Europe. So similar experiences are being faced if the infrastructure is good. So we are going to spend some time on the infrastructure.